Start with another important medical emergency, which is the seizure. So how will you manage the patient with the seizure disorder? So what, let's start it. Bismillahirrahmanirrahim. Okay, so what happens that the always remember, treat this patient when the seizures are well controlled in them. Okay, when the seizures are well controlled, and check the levels of anti-seizure medications, because that the patient's compliance is questionable or not. Basically, use anxiety reduction protocols basically, and avoid glycemia and fatigue. How will you avoid hypoglycemia? That tell the patient to take proper breakfast before coming to the dental procedure. And fatigue, give a patient proper medication or diazepam for a good sleep before the night of treatment. Okay, okay. Now very important, how will you the patient will come with what signs basically. So the patient have a brief seizure, isolated, has a tonic clonic basically movements and extremities and trunk, loss of consciousness, vomiting and airway obstruction, loss of urinary and inner spatial control. Okay, in acute management, you will do what you will stop all the treatment, have a supine position like supine position, and protect from nearby projects. Always remember that the patient with the seizures, remove all the projects around them, because might they can harm themselves. So remove it and do not restrict them. Okay, that you hold their hands, no, never do it, never restrict them. Okay, if the after the seizures, what you have to do, that if the patient is still unconscious, so have someone medical assistance is very important. Basically, put the patient on site, and section airway, monitor the vital signs, basic life support, oxygen, and give hospitalization. Section airway if necessary, monitor the vital signs, give administration of oxygen, consult the physician, and choose observe the patient in office for 1 hour, and have excurbated with home, have patient excurbated home, mean that there are people. Okay, now what happens is the patient have the sustained or continuous or repeated seizures, which we called it status epilepticus. So what you will do, you will give uh, 5 milligram per mint IV diazepam up to 10 milligram. Okay, 5 to 10 milligram diazepam you will give IV, but you can also give midazolam, which is 3 milligram per mint IV intramuscularly. Okay, up to 6. So diazepam 10 to 5 to 10, and midazolam 3 to 6. Okay, have someone summon medical assistance and protect the patient from nearby projects again. Acha, what happens to do when the seizures are ceased? Place the patient on site, and of course section airway, monitor vital signs, basic life support, administration of oxygen, and hospitalization again. Okay, so basically, total dose can be double if no signs of respiratory depression occurs. Okay, always remember. And basically, total dose should be half in children and other patients. So what you have to do, always remember, if the patient have a seizures, so stop all the treatment, place in supine position, and remove all the sharply projects, protected by, if the patient is unconscious still, so have someone medical emergency put on one side, a section airway, monitor wise, and basic life support, administration oxygen, and transport emergency. Okay, now if the patient is unconscious, so basically you can have section where if necessary, monitor wise and administer oxygen, consult physician, and observe for 1 hour, and have patient escorted home. But if there is a continuous, what you will do, you will give 5 to 10 milligram diazepam or midazolam to 3 to 6. Have someone medical assistance, and remove all the nearby projects once the seizures are stopped. So basically, please check the airway for patent or not, then monitor voice signs, basic life support, and basically also place the patient on one side, administer oxygen, and transport to emergency. Very important. Now, another very important topic that most of the patient have is orthostatic hypotension. That says suddenly the patient stands and the blood pressure is fallen. So, okay. So basically, what happens? This problem occurs because of pooling of blood in the periphery. So what happens that suddenly the all the blood moves to the periphery. Basically, that it is not remobilized quickly enough to prevent cerebral ischemia, means that all the blood suddenly moves to the extremities and does not basically reach the head. So what happens? There is cerebral ischemia. So the patient rapidly assumes in an upright posture. Okay, when a patient is suddenly stand up, okay, the patient will therefore feel light-headed or have some dizziness or fainting type. The patient with orthostatic hypotension who remain conscious will usually complain of palpitations and generalized weakness. Okay. So always remember it is because of pluming or blood in the peripheries. This is not enough to prevent cerebral ischemia. The patient has it occurred because of upright posture. The patient feel light-headed, and basically what happens that the complaint of palpitation and generalized weakness. Okay, how will you manage this patient actually? So always remember in any emergency, first you have to stop all the dental treatment. Okay, like. Basically in seizures also this places this patient in a supine position with the legs raised above the level of head. Why you raise the legs above the head level? That the blood should move to the head actually. So rise, so sorry, with the legs raised above the level of head. Monitor the vital signs, check the bb improve, slowly return the patient to the sitting position, and then slowly make her sit. Discharge the patient home once the vital signs are normal, means when everything is fine, and obtain medical consultation before any further dental care, and always consult that physician of patient physician for further basis. So always remember that you have to terminate all the treatments, place the patient in supine position, and leg rise above the level of head. Number two, then monitor the vital signs. When the bb comes to normal, then slowly make set the patient in sitting position, and check the vital signs, then send if they are fine, so then send it home, then consult the physician. Okay, bas.